Welcome back to West Texas View.
Welcome back to the West Texas View. I'm Johnny Lou Avery, and Dr. Tad Mitchell has been visiting with us on his trip here to visit the Odessa and Midland Texas Tech Health Science Centers. He's our new president of the entire Texas Tech Health University's Health Science Center. Before the break, we were talking about his credentials and some of his vision and his passion within the medical community, but I want us to get back to talking a little bit about your family.
Sure. Well, as I had mentioned, I met my wife in medical school. My wife is also a physician, and she actually practiced with me at the Cooper Clinic for nearly 20 years. We have 3 children, 1 in college and 2 boys that are finishing high school. And when the opportunity for a career change came up with Texas Tech, as we started thinking about things, okay, we're going to be moving from Dallas to West Texas. Again, a lot of my friends are saying, oh my gosh, that's such a big move, but it really isn't, because my wife is an avid horsewoman. She's competed in equestrian events for many, many years, and so for her, the opportunity to have a larger area to ride was just, it didn't take her 2 nanoseconds to determine this is the thing we need to do. So it's been wonderful. She's been competing for many years. She competed in high school, and then as we started, as she got busy with college and with her medical education and with her postgraduate training and setting up a practice and having kids and this and that, the riding kind of fell off to the wayside. But about 10 years ago, she started riding again, and since then, it's all I can do to get her to pay attention to me a little bit.
But then one of the things that she sees is this area is rich in horse people.
Oh my.
And we have the polo on the plains and
well, it's to the point that as I'm getting out and trying to get to know the folks that I'll be working with professionally and the like, she's meeting everybody that knows anything about horses, and so she's already got an entire group of folks out here that she's been to dressage stables and western stables, so she's already really plugged into the system.
Yeah.
So it's been great.
And the interesting thing about that is it will help her to advance the Texas Tech University Health Science Center in a whole new way.
Well, I will tell you that's absolutely true. They've got a good rodeo team. They have a good equine program at Texas Tech, and she has already said that a lot of her passion as far as fundraising efforts and things will be directed toward that as well. She's obviously very passionate as a physician. She's very passionate about things related to the Health Sciences Center in particular, but in general, she's very interested in everything related to equine programs. Like they've got a therapeutic riding program. They have a lot of things that are wonderful. Yeah. And as you know, this is not an inexpensive proposition.
That's right.
When it comes to caring for horses and caring for them correctly, it's expensive to do.
It's expensive time-wise too.
It is. It is. At the end of the day, it takes a long time.
Yes, we have had. In fact, that would be interesting to have her on and talk about the therapy involved with that, because we've had the dog therapy, the pet therapy programs, especially with our mental health facilities in Big Spring, and also with senior citizens in nursing homes and that.
Yeah, well, and it's she'd actually, when she was first in college, she had actually thought for a while about being a veterinarian. And she actually worked with a veterinarian for a while and said, look, I can't handle this. You can't explain to animals, I'm about to hurt you, and I can't explain why. At least with people, you can say, look, this is going to hurt, but it's for your own good. So anyway, so that's very much a passion for her.
Well, that's interesting, and she will be welcomed with open arms, I can tell you, in this part of the world.
I hope not too much, because then she'll never be around the house.
But tell me now, and so your boys are all.
We have boys that are finishing high school, and they've actually spent a lot of time this summer in Lubbock. And the interesting thing for our children, my daughter's launched. She's at the University of Alabama. She's on her way. But the 2 boys, they've never moved, and our family's never moved. And so the whole transitional
just the
thing, has been
leaving friends and making new friends.
Well, the challenge is just getting them adjusted to a new environment. So. But we're doing well. Everybody's doing real well.
Good. Well, that brings us now to your vision. You mentioned a little bit about the excitement that you had because you already knew it as a member of the search committee
Sure.
in the past when they've been looking for presidents. So you knew a little bit about the vision and the excitement that was generated most recently in Abilene when they came
Sure.
into Abilene and have the nursing and pharmacy school and
Right.
so on. And so talk about, that was probably one of the reasons why you was excited to come.
I was very excited about the entire idea about the health sciences system. And I think it's really important for people to understand how it is the state of Texas kind of divides up responsibility for health care in the state. You have areas, the academic centers, that are responsible not only for educating health care providers of tomorrow, whether they be nurses, doctors, pharmacists, whatever it may be, but they're also responsible for delivering care to the people in certain areas and being the center of the delivery of care for certain areas around the state. So for example, if you look in the southeast Texas area, you have Harris County, where Houston is, and the academic center in that area, the teaching hospital, is Ben Taub. The primary teaching center is Ben Taub Hospital. So they're responsible for this highly dense population of folks right there in southeast Texas. All of the surrounding counties are then funneled down toward UTMB, University of Texas Medical Branch in Galveston. So they become responsible for providing care for those counties in southeast Texas that are outside of Harris County. If you go up to the northeast Texas area, you've got Dallas, where you have Parkland Hospital, that's responsible for the population density there. And so they divide the state up in these areas. The West Texas area is where Texas Tech is responsible for providing care. Our system is responsible for 108 counties. 108 counties. Now that is about half of the state's geography. And yet we have only about 15% of the population. And yet those folks, they need health care as well.
Well, and they're even worse off because they are so isolated,
Exactly.
so far away from
We
any
have
facilities.
54 counties that are not even considered rural. They're still considered frontier, but those folks need care as well.
And if you have a wreck at Sierra Blanca, it's
Right.
pretty hard to
You're
get
out in the middle of nowhere.
an ambulance. And that's why when we did a program about Doc in the Box,
Right.
and a doctor in Alpine could call in, and I received so many phone calls from that what a giant leap that was. And
Sure.
so I was very interested in that. Well, this is just the beginning of your vision that we've got to continue talking about the overall picture, and then we're going to get specifically into Odessa and Midland. We're going to take a quick break. We'll be back in just a minute and continue this conversation.
Stay tuned. West Texas View will be right back.